right, good afternoon, everybody. Yours truly, Dr. Barry. First of all, we are coming live from multiple different places. We are on Facebook, Periscope, YouTube. We are in my group, my personal page. And really, obviously, the topic at hand is what are we going to do right now, right, with the coronavirus and the fact that our president now has this virus. And I've been getting a lot of questions. And as you know, I kind of took a little break on our podcast, but I got so many questions. I just figured, you know what, let me just hop online to really try to answer a lot of the questions, a lot of the information that we're seeing really coming out at us on a time-to-time basis to try to get a gist of what's happening here, right? So again, for those who may know, especially if this is your first time watching, I'm Dr. Barry Pierre, board-certified internist, founder of drbarrypr.com, podcast host, live vlogger, of course, and blogger. And what we're going to talk about today is what do we do now that we know that the president has the coronavirus? And of course, my legal discussion that we always start, again, even though I'm a board certified internist, director of medical education and all those, criteria and eligibility, please, if you have any medical information, please obviously go to your personal doctor for your information. But I'm going to educate you a little bit today on, this coronavirus, if you don't know, right? And then really, what are we supposed to do with this, the fact that our president has this, right? Hey, Dr. Middleton, how you doing? So first and foremost, like I said, if you ever need any coronavirus, COVID-19 related issues, I always point to one website and one website only. The reason why is because it's not biased per se, right? Like I say, even though, again, I'm as a physician, I may have some biased positions behind what I may put out, right? I always say, if you got to choose one website to go to, right, you're going to go to the CDC, right? So first and foremost, so let's do that first, right? Before, we kind of get that way we can kind of get a mental picture of what we're dealing with, unless for some crazy reason for this past 6 months, you've been living under a rock and you have no clue what the coronavirus is or how much it's really been affecting everyone. Let's go to our CDC page. Like I said, I love our CDC tracker. Big fan of that. So, of course, we're here, right? This is coronavirus. Again, this is really only focusing on our cases here in the United States. Right? As you can see, 7.3 million have been affected with COVID-19. And, of course, most importantly, part of that 7.3 million now includes our president as well as his wife. Over 200,000 deaths. Here, like I said, look at this, just the amount of cases just in the past week, right? And again, this is just a case of the United States, right? As you can see, some colors are a little bit darker, some are a little bit lighter, just to kind of tell you as far as their number of cases, especially within the past 7 days. And reason why I want to bring you to this page first is so we can kind of all get the gist of what's happening, right? Of course, obviously, the fanfare is going to be big on the fact that our president has it, right? But understand that this is a disease that has been here probably since the beginning of the year. It is not going nowhere. It's not going away anytime soon. So just so we can kind of get a mental picture of what we need to do, what's happening, right? And again, I talk about this a lot, especially when I talk about this number of cases, when I talk about who's affected. I've had, I've had podcasts and video discussions before, as far as, just from a health disparity standpoint, how we know how this virus has really affected the minority, especially African-American community, Hispanic community, at a much more significant rate than every other community at hand. So, of course, this is definitely very near and dear to me when we talk about this virus. And being a hospital physician, one who takes care of patients in the hospital setting, very important when I, any COVID-19 related news, right? And of course, this is obviously the biggest one to kind of come out. And just got a quick little stop there. So what we know, right? What we know is that what initially started as one, I believe is this aide. I don't even know who this person is. Hope Nix as his aide or whatever she does within the White House, came down with this positive test. And like we've been saying pretty much for the past, 3 to 6 months, right? Social distancing, wearing the mask, trying to protect yourself, because not only are you at risk, but everyone around you is at risk. Unfortunately, because of this administration, we know that they really have not really taken that mantle, at least in the early stages. And they really don't show that much of a great example of making sure that that does not become an issue, right? Where, you got a lot of social gatherings, a lot of, things happening, people not wearing a mask. So we really shouldn't be surprised at a scenario like this, right? So just kind of give you an idea, if you're not aware of who's been, affected thus far, right? Just from a sheer numbers game. Give me a second. Right. So this is a list of people who have, at least at what we know of thus far, have been affected and come positive with COVID-19, right? Trump, him and his wife, Hope Nix, Kellen Conway, whole bunch of senators, and of course, our nameless people, right? 3 White House reporters, 11 staffers, right? Especially from the debate. Chris Christie's on there as well. His bodyguards on there as well, right? So just so we can get a, mental picture, a lot of people have been affected and again, we're not saying that Hope Hicks is the first one to have it. We just know that she was the first one diagnosed with positive symptoms. And again, what we talked about before, right? Yes, having a positive symptom is one thing, but what occurs next, right? And what's really kind of caught the public eye, especially in the healthcare world, right, is this intention, right, of care that has occurred for a person who we're telling us isn't that quote unquote sick, right? As a hospital physician, we take care of patients in the hospital who require to be in the hospital with COVID-19. I do it all the time. That just is what it is. And as a hospital physician, when I'm seeing, people being admitted to the hospital, I'm much more concerned because I figure their symptoms have to be worse, right? Because there's really no reason for you to be in the hospital unless you're very sick. So initially, we hear this diagnosis happens, I think, on Wednesday or Thursday. And, probably 24 hours later, it comes down that, our president has it as well. Right. And of course, that's a concern. Right. Because, again, we have a lot. Again, even though we looked at that CDC, about 7.3 million have been diagnosed with it. We know there's actually probably closer to 8 to 9 million who just don't know because they're symptomatic. So the hope, right, was that, yes, he's positive, but maybe he's asymptomatic, right? Maybe he doesn't have any symptoms or concerns associated with this virus. Unfortunately, the tale of events that occurred pretty rapidly tells us a very different story. First things first, he has it. He has no issues, no concerns. And then less than 24 hours later, he's being transferred to the hospital, right? Again, as a hospital physician, one who takes care of patients in a hospital, that is very concerning because why would you, an able-bodied person who has no symptoms, actually need to go to the hospital? And I don't care what your stature is, whether you're the president of the United States or whether you're this Joe Blow who works down the street, right? Why are you having to go to the hospital if nothing's wrong, right? And then this series of events that occur, right, that, really kind of are causing a lot, especially my colleagues are scratching our heads of concern because we're not sure what is happening. So not only, has he been transferred to the hospital, he's been placed on a series of medications that typically those patients, when you get on those types of medications, you're a lot sicker than what you're trying to tell us, right? Like what you're trying to show or present to us, you're a lot more sicker than that. We know thus far he has been placed on medication called remdesivir. We know thus far he's been placed on antibiotics. We know for sure he's been placed on oxygen therapy. But I think the most important thing, right, and this was one that really took me, by surprise, right? And I want to kind of show you this instance here. He has actually even received, let me see, he's actually received some experimental medication, right? So this right here is where I'm, my eyes are very wide open, right? For those who don't know, right? Again, I've talked about this before. There's a lot of different companies working on a potential vaccine for COVID-19. A lot of companies working on it. A lot of companies that are at different stages. Now, again, 2020, don't expect anything viable. I've told this before. In 2020, don't expect anything viable. But 2021, you're going to see a lot of competitors start coming out with potential vaccines for this virus. Again, and actually in my residency program, I just did a journal article on one that was done by, I believe it was a Novavax. About their vaccine, right? So there's a lot of different companies working on it. But again, this biotech company, Regeneron, right, which is one of many who are coming out with a potential vaccine. For some reason, he takes this antibiotic vaccine, right? So again, as a physician who takes care of patients, this vaccine right here is not eligible for anyone to give. I can't give it to any of my patients who are sick right now, right? I can't give it, correct? Because it's not out yet. It's not even approved to get it. But here we have the president of the United States not only getting this battery of tests, not only getting this battery of care that doesn't make sense, right? Unless you're telling me unless you're not telling me how sick this person really is. But now he's getting this experimental vaccination, right? Which, of course, is a concern, right? Again, this is now, if I had to rank, right? Again, we're not here to rank here, but if I had to rank the list of antibody vaccines that are going to be out, this one isn't even in like the top 2 or 3, right? As far as not, I want to say efficacy, right? But as far as just the speed and ones that should, like, their trials should finish quicker, right? It's not even like in the top 3, right? So like, why did he choose this one? I don't know, right? I'll leave that up to you guys, right? To kind of decide why did he, out of all of the ones he could have possibly chose, why did he choose this one? I have my theories, I have my thoughts, but again, we're going to keep it very PC here. But he chooses this one, right? So again, now I have and I don't want to hear that he got it just because he's the president of the United States, because that doesn't make any sense whatsoever, because these vaccines can have side effects as well too, right? So again, it just doesn't make, I don't want the president of the United States, taking a regulated medication, right, that could cause harm, right? That's not something that I actually would want to champion for, despite, my thoughts on him. So again, I have this president who went from, I got no issues, I got no concerns, I just found out I was diagnosed 24 hours ago, to all of a sudden I need to go to the hospital. I need to be put on all of these batteries of medications, like all of these things, again, that just aren't really making sense for us here in the medical world, right? So in the medical world, right? So we are all, especially the internists, the infectious disease folks, all those folks who, again, take care of patients, right? We're all like, all right, what is happening here, right? Because something is not making sense. And unfortunately, especially with this administration, who has a history of not really telling us the full truth, we're not sure what to make of it, right? But let me tell you this, right? If me personally, right, if I was diagnosed with COVID-19 today, no way would I be in the hospital tomorrow, right? Because we know, again, and I've talked about this before, we know the disease process usually takes about a week or so to kind of go into the system and cause some issues, right? So this isn't like, again, if I give you COVID-19 right now, you're not going to have symptoms tomorrow. It's just not, your body does not work that fast to do it. You may have symptoms in like a week or so, but you're not going to have it like right now. So the question becomes like, was he having symptoms beforehand and he wasn't telling anybody? Was he, or is this kind of all fluff? Again, at this point, I don't know. But like what I do know is we have a lot more questions, right, than answers that we're getting, right? Especially from the White House physician, right, Dr. Sean Conley. Now I want to first I want to start off, and I knew this because I'm obviously, I'm on social media a lot, so I knew this was going to trip up a lot of people yesterday, right? Dr. Conley, right, is an osteopathic physician, right? Like I made it a point, right? You could see on the top, I guess, right, bottom right of me, that I made a point to put DO, MPH, FACOI, because I saw a lot of people, right, really like going out on a limb and showing people that they're not as smart as they are, right? Because I have seen a lot of people, oh, this guy's not even an MD. What could this guy who's not an MD tell us? And I realized very quickly that still majority of the public don't realize that an MD and DO are both practicing physicians, and DOs do a lot more training, right? So I made it a point, right? I usually just put Dr. Barry on my second, but I made it a point to make sure I include DO, MPH, FACOI, because there may be some people who are watching this like for a second, third time, fourth time, and not even realize that I was an osteopathic physician. So I want to make sure we clear that out the way. Yes, he is a trained physician. I think he's emergency medicine. I think he's emergency medicine. He's a trained physician. He's a DO. So please don't put any, social media posts about like, oh, this guy's not even an MD, because then you sound crazy. I don't want you guys to sound crazy or look foolish on Al Gore's internet. So don't do that. Right. So that being said, his, I saw the press conference, right, and his timeline of events. When was the president first diagnosed? Inconclusive. What treatment has he gotten? He's being very evasive. Again, this is a physician who clearly has permission to talk about, what is this president's got going on, but he's being very evasive, right? And again, like I said, if you don't know, if you're not in the know, right, you're not going to realize he's being very evasive, right? Because a lot of questions we have, right? For example, a lot of the medications that President Trump, right, is taking right now, we typically don't give it to patients who are walking around. Like you see me, I don't have no nasal cannula. I don't have a machine breathing for me, right? So we typically don't give certain medications to patients who are not even on oxygen. Right. But for some reason, right, again, because he's the president, right, because he's the president, he's getting this battery of medications and antibiotics and treatment that doesn't make any sense for a person who is, quote unquote, healthy. Right. Who's, who's still for some crazy reason still doing work even at the hospital. Right. I saw a couple of videos that he was like signing papers. Have no clue why. Right. So again, that's one thing, right? So I'm seeing a patient, right, who, again, President Trump is a patient now. I'm seeing a patient who is on this battery of medications, who's taking, unregulated, unapproved vaccines, right, from a company who I'm almost sure, right? I'm sorry to say it, I'm almost sure he has some financial ties with it, like, because it really doesn't make any other sense. So I see this person who, again, we're going to treat him like a regular Joe Blow, right? We're going to treat him like one of the 7.3 million, right, who already have it here in this country, right? And we're going to treat him as such, right? So I'm seeing this person who is supposedly not on any oxygen therapy, but for some reason has to require remdesivir, right, which is an IV medication that you're going to have to take for 5 days. So he's going to be in the hospital for at least 5 days. Who is on steroids, who's on antibiotics, who's getting all this kind of treatment of care that doesn't make any sense for a person who isn't as symptomatic as they're telling us, right? Again, if we believe it, right? So I think that's the crazy thing, right, that we're having to deal with, right? Again, and mind you, if you're not necessarily in the medical know, right, like a lot of that stuff may kind of go over your head. Right. But I got a lot of physician friends, right? Fortunately, I got a lot of physician friends, and we're all looking at this like, all right, something is not making sense right now. Either our president is very, very sick, right, and they're not telling us he's very, very sick, which is very concerning, or our president is not as sick, but for some reason he's getting, a Cadillac of treatment that he shouldn't be getting, right? Because again, and I'm not saying he shouldn't be getting it because he doesn't deserve it. I'm saying that the medical literature shows that there's no evidence that if he gets these medications that he's going to do any better, right? So there's no medical evidence because like I already see what's going to happen, right? Let me tell you what's going to happen. Like I go to work tomorrow, right? I'm gonna go to work tomorrow and I'm gonna get a slew of patients, right? Especially if they come down with COVID-19, right? Who are all of a sudden are going to wonder, Dr. Pierre, how come you're not putting me on this medication and this medication? And how come I'm not on this? Like, I already know what's going to happen, right? Like, and again, and that's really the problem. And I'm going to have to try to explain to them, like, no, fortunately for you, you're not as sick, right? So you don't need all of these medications here, right? Like, because again, the evidence doesn't say, again, I'm not saying that he shouldn't get it because he's not the president. I'm saying that he shouldn't get it because there's no medical evidence to say so, especially when you're dealing with an experimental vaccine that, is not out to the public yet. It can't be out to the public yet because they're still doing trials on it. Especially when you're dealing with that, right? Like that's something we should be, those are just red flags that are going off for me, right? And again, because I see what's happening on social media now, I'm seeing all of these elected officials talking about they're going to be checking in to the hospital for precaution. First of all, don't come to the hospital assuming that you're going to be admitted to the hospital for precautions, right? Because my ER doctors will send you home, right? So I don't want no one to set yourselves up for failure thinking that you're going to walk into the hospital and be admitted to the hospital and get this battery of testing and this battery of medications for precautions. That ain't happen. That does not happen. Unfortunately, what we're seeing here, right, and this is unfortunately the society we live in, we're seeing that there's two different healthcare systems for those who have and those who do not have. Right. So we're seeing a system where those who have, the president, right, is getting this battery of medications and treatment course that he should not be getting, not because he does not deserve to get it, because there's no medical reason. If I'm listening to what you're telling me, and again, I'm only going by what his doctor is telling us, right? Like I'm only going by what his doctor is telling me. His doctor is telling me he's not on oxygen. He's fine. He's walking. Like his doctor is telling me that he's great. But yet, like they're still on all of these other medications here that a person who is great should not be on. So something's got to give, right? And like I said, let me see. So at this site, I love, first of all, I'm a big fan, especially those who catch me on the other lives. I like statnews.com, especially they got a great health section. And they ask, 8 pressing questions, right, that I want to make sure, we all kind of get to. Because you guys may have the same pressing questions as I. Let me see. So, what is what is Trump's condition, right? Again, if I am to believe, right, what the ER doctor is telling me, right, like I don't think his condition is great, right? Because he's telling me one thing, right, but the treatment course is telling me a whole nother thing, right? So that's really kind of up in the air, right? Because again, this is a guy who supposedly is walking around still doing all of this work, requiring no oxygen, but for some reason he's on medications that we only put patients who are on oxygen for, right? So that's one thing, right? When was he diagnosed, right? Very important question, right? Because like I said, I talked about it. Our COVID-19 diagnosis, as far as you becoming symptomatic, right, usually takes about a week or so, right? So it usually takes about a week before you're developing symptoms. So if he just got diagnosed, again, 2 days ago, right, when was he actually symptomatic? And if he was symptomatic and not telling people he was symptomatic, that is a problem, because we already know he was at the debate. Fortunately, President hopeful Biden is negative, right? But we know he was at the debate. He was at fundraisers. He was at he was at these rallies. So it's not like he was socially isolating himself for this past week, right? He was out and about, which is why so many people are coming down positive, right? Because we know him and his team roll pretty deep and pretty tight knit. So we know a lot of people have it. So when was he actually diagnosed? When was he symptomatic? That's what me as a physician wants to know. Again, this kind of follows to the same question, right? Where did he contact this virus, right? Again, a lot of people are going to point to, Hope Hicks, with her positive diagnosis. But again, she picked it up from somewhere, right? When was she symptomatic from it? And, was she just happened to be the first who got diagnosed, or was there others, right? Again, that we're not sure what's kind of going on there. Again, and where was it? What were Trump's interactions between when he got the virus and when he started quarantining? We know that he only started quarantining 2 days ago when they moved them to the hospital, right? Like that was when the quarantining started, because he was out and about literally the day before, right? So we are aware that there's a lot of people who are at risk. Again, I showed you that page as far as the amount of people who've already been affected. We know there's a lot of people who are already at risk for this virus, right? Because he was out and about everywhere, right? And again, when you don't social distance, when you don't wear your mask, right? Like this is the type of stuff that happens. What will the next week be like for the president? Again, if this guy was not the president and he was my patient, he would be in the hospital. Again, if I'm going by the dates, he started that medication again. That's about 5 days. He started it on Thursday, so he's in that hospital for at least Friday, Saturday, Sunday, Monday, at least Tuesday, or maybe most likely Wednesday. So he's going to be in the hospital till at least Wednesday. If he leaves the hospital before Wednesday, I'm going to be giving a side eye as well, because we know that medication is a 5-day medication for people who are typically on oxygen therapy. When you're not on oxygen therapy, you don't even get that medication started. Again, if you come to Wellington Regional, if you're not on oxygen therapy, you're not getting remdesivir. Let me tell you that right now. So just so again, because I already know what's going to happen tomorrow or this whole week. When I go and I'm taking care of patients, because they're going to be asking for, how come I can't get what the president got? And unfortunately, it's because we live in a society where those who have get it, and those who do not have or don't have the opportunity do not. This is a big one too, right? So why treat him with both Regeneron's monoclonal antibody, that's the vaccine I was talking about, and Gilead's remdesivir? Again, I read articles, right, that he does have financial interest in both, right? Unfortunately, it just is what it is, right? He has financial interest in both. There is no medical indication for you to receive both, right? There isn't any right now. So is this what we call kind of an overkill? Because the patient, again, we'll call him a patient, because this patient just happens to be the president? Most likely, right? Like that's 100% sure. That the only, because there's really no indication for you to require both of these medications. One, because the first one's not even FDA approved yet to be given out to people, right? And the second one, if what I'm believing to be true, what you're telling me that he's not on any oxygen, he's walking around, he doesn't need it either, right? So I think this is kind of an overkill aspect there. How will Trump's diagnosis affect America's view of the pandemic? Let me tell you something right now. 7.3 million already have been positive with the disease. We already have 200,000 people who have died from it. If for some reason you needed this person to get COVID-19 for you to be like, oh, you know what? Now I'm going to take this serious. There's nothing I can do for you, right? I'll tell you that right now. There's literally nothing I can do for you. If like all of a sudden you needed the president to get this disease for you to be like, oh, you know what? We got to start taking this thing serious, right? Because 7.3 million here in the U.S. only, again, those are just U.S. numbers, 7.3 million already have it. 200,000 people have already died. I've taken care of a lot of people who have died from this disease, right? So if for some reason this is what jumpstarts you to like say, oh, let me take this COVID-19 serious, let me wear my mask, there's nothing I can do for you. Again, I would talk to your doctor, right? Like that's something you got to do if you're on yourself. And then, of course, this question here, what does this mean for the campaign? Me personally, I don't care. Like the really most important is we got to make sure that people are going to be safe around him, right? Especially if he's still going to be doing rallies and all these things here. We already know, remember we had Herman Cain who went to that rally, died because he picked up COVID-19 from the rally. This is going to continue to happen, right? Please be safe. Please be safe. Most importantly, right? That's really like the course at hand, right? Like I need people. I'm hoping, right? Again, because I know I'm talking to, unfortunately, I'm not really talking to a small population now, because there's a big population, especially people who follow him, who really used to like call this like the China virus, right? Like, remember, I know y'all used to call it like the China virus because y'all really like tried to put it all on China. Now the president has it, right? And now because the president has it, now he knows he needs to call it COVID-19, right? Like he let out a tweet and he made sure like, hey guys, like I've got COVID-19. I've been diagnosed. Like he didn't call it the China virus then because it hit him across the face, right? And that's what happens to a lot of people, right? A lot of people, like when you're on the outside looking in, it's very easy for you to kind of brush off what's been happening to 7.3 million people here in the U.S. and what's been happening to the family members of the 200,000 who've already died. Right. Like just like he said, it is what it is. Right. Like so now it is what it is. Right. Now you got COVID-19. Right. So I fully expect his whole rhetoric to change. Right. Associated with COVID-19. My concern, right, as a physician is like someone's not telling us the truth. Right. Like either this guy is very, very, very sick. Right. And they're not telling us he's very, very sick. And that's a problem. Or he's not sick and he's getting this battery of medications that he should not be getting, right? And that's going to set up people like me for failure, right? Especially when you come into my hospital and you're asking me, how come I can't get all these medications? And I'm telling you, because you're not sick enough. And you're going to be like, well, the president wasn't sick enough either. And I'm going to say, well, he was the president and you are not the president, right? And I don't want to have that interaction with my patients, right? Again, I love my patients, right? I got to take care of them, right? But like, this is the precedent that he's setting, right? He's setting this unrealistic precedent of a treatment course that does not apply to everyone. And we know it doesn't apply to everyone because there's no evidence to show it, especially again, like I said, I don't know why he chose that experimental one, like, especially because again, there's a lot of different companies that have vaccines, right? That look good so far, right? In the studies, right? How come he didn't choose any of those? I don't know. Right. But he, again, like I said, if I had to choose, right, if I was the president, and you told me I had to choose one of these different companies, right? There's probably like 2 or 3 other companies I would have chosen before I chose this random one over here, right? So why did he choose it? I have no clue, but he chose it. It is what it is. I want y'all guys to be safe, right? I hope I've answered all of your questions, right? As we can, right? Yep. Yeah. Yeah. Perfect example. Michael Switten. My lawyer friend talked about the fact that, like, as you can see, right, one of the medications he's not getting, right, is that Plaquenil, right, or hydroxychloroquine. And it's very funny, right, because, again, he was on Al Gore's internet telling us everyone should get Plaquenil and, because, again, he's got financial interest in that too, right? But as you can see, out of all of the medications I talked about him getting, Plaquenil is not one of them. Why? Because we stopped giving Plaquenil, hydroxychloroquine, to people in, like, April. Like we've been stopped giving that medication because we've been knew that medication was no good, did nothing for it. In fact, what it did, right, unfortunately, right, for my patients who have lupus, all of a sudden they couldn't even get their Plaquenil, right, because all of let me call out some of our dumb doctors, right? All of our dumb doctors who, even after we told y'all stop, giving Plaquenil, was taking Plaquenil like it was vitamins, right? So now, if I'm a lupus patient and I take Plaquenil every month because that's what I do for my lupus, all of a sudden I can't even get my lupus medication because the pharmacist is telling me it all ran out, right? And again, I'm side-eyeing a lot of my physician friends, right? Because a lot of y'all were doing it. Y'all were like prescribing Plaquenil like it was vitamin D, right? And giving it out to everyone. And my lupus patients, right, who come in the hospital couldn't get the lupus medications because y'all gave it out away. So like, don't do that. But like I said, it was very funny. Again, that medication he was screaming for us to kind of get at the rooftop, he ain't even touched, right? Why? Because no physician, especially in September, or now we're in October, right, is prescribing that medication. We got rid of that medication a long time ago. We've been stopped using that medication, even though he was trying to tell everyone they should be on it. Again, I got my reasons why he was probably telling people, but like, it is what it is, right? So again, President Trump, you got COVID-19, your wife got COVID-19, a whole bunch of other people got COVID-19. It is what it is, right? Hopefully, right? Hopefully you pulled through, right? Especially for because this country has been enough through 2020, right? But hopefully, what I'm hoping, right, not necessarily for you, but for all of the people who follow you, right? Hopefully this changes your mindset, right, on the importance of social distancing, portions of wearing a mask at all places, right? Like they're just they're just crazy. It's crazy that we had our leader telling people that the mask wasn't important, and now he got COVID-19, and now he's looking crazy in the face, right? So y'all be blessed, be easy. I'm Dr. Barry Pierre. Again, follow me, Dr. Barry Pierre, at all social media outlets. Shout out to Facebook, Twitter, as well as YouTube family. Y'all be blessed, be great. Have a good one.